Dr. Abugri, what can you tell us about compassion fatigue?
So compassion fatigue, simply put, has to do with that kind of mental breakdown that comes from people who are involved in caring for animals. Most of the times, people do not have that kind of knowledge that, let's say, veterinarians or people who work with animals can develop some kind of mental health issues due to their nature of their work. It's more of like a coping mechanism.
You came with a point of view of a doctor. Let's look at it from the point of view of a pet parent. Because, like it or not, some of them are at the forefront of observing suffering all the time. It's been a while. So this is the Vet Podcast, and we are here today to talk about the cost of caring, aka compassion fatigue, as psychologists and our friends in mental health will put it. Now, it's interesting to look at this because aside the monetary aspect of healthcare, in terms of clients, patients, there's also emotional costs, and that is what this episode is all about. So today, with me in the studio is Dr. Henry Abugri, the co-host to this podcast, and myself, Dr. Emmanuel Boachenim, discussing the cost of caring, compassion fatigue in pet parents and doctors. They are doctors, veterinary doctors. So to kick the ball rolling, Dr. Abugri, what can you tell us about compassion fatigue?
Most of the times, people do not have that kind of knowledge that, let's say, veterinarians or people who work with animals can develop some kind of mental health issues due to their nature of their work. So compassion fatigue, simply put, has to do with that kind of mental breakdown that comes from people who are involved in caring for animals or even people, because generally speaking, it affects professionals that have to care for people. So in a situation where, because of your constant emotional investment into the health of either people or animals, you become apathetic towards their needs. People call it mental exhaustion. So you are basically tired after investing so much of your emotions into the health of an individual or an animal. Time comes where more like you are built as some kind of immunity towards emotions. You see the patient suffering and you feel nothing. It's like you have become a robot. Yeah, everything has been switched off.
No, it's like I don't think it's nothing. You feel something, but you do
cannot
not want to
respond.
acknowledge
Yes,
it and respond
to it,
accordingly.
yes.
Yeah. So it's a good point. I mean, when you look at it, it's both mental and physical exhaustion. If you look at it in the strictness of the term, because sometimes, I don't know for you, but there are days, especially, I remember one day I lost a patient early in the morning in the clinic, and I felt exhausted throughout the day.
Yeah.
And this was a patient that was recovering, and all of a sudden,
It's like
we just lost the patient. So when you look at it, it really affects us. And imagine having to deal with other patients. Fortunately, I had somebody to cover for me during that rotation. What if I didn't have anybody? It means that I was going to go through the day either trying to discredit any form of emotions I had, or go through exhaustion over exhaustion over exhaustion over other cases that came. And so, like you mentioned, it's about having prolonged exposure to suffering of others, in our case, animals. So, since we are saying a person gets immersed in the suffering of others, and so at a point become exhausted mentally and even physically,
Basically.
does that mean that we should block off everything when dealing with our patients or when dealing with people? Because sometimes our pet owners, pet parents, as we put it, would want to say certain things, would want us to acknowledge certain things, but because we are emotionally distraught, they tend not to get the kind of response they want. I mean, does that mean we block it off because of the constant exposure to the stresses, considering in our part of the world where by the time the pet is being most of the time, we get to see the patients when they are in the worst
Yeah.
of their conditions. Does that mean we block and discredit any form of emotions that we have whenever we are dealing with our clients and their pets?
It's a very interesting point. What I would say is that I think that it's more of like a coping mechanism where, for me personally, I had to develop that to prevent myself from being too much invested, because there are days where you actually put in all your emotions, your energy into a particular case, or into a client, or into a patient, and then you lose a patient. All of a sudden your whole day is messed up. Just as you said, you lost a patient early in the morning and the whole day was messed up. And so when other patients also come in, you don't have that kind of zeal or energy to even continue, or to even um, do your best to help them out. So it actually affects your productivity. So I think it might look like you are closing off yourself from people, and our clients most of the time want to see us as emotional people, as people who are human. And so when they complain about the pain and suffering of their pets, they want to see some reaction, want you to show that you actually care. But there are times where, after being exposed to so much suffering, it gets a point where, as I say, you become almost immune. And so your default state is always like, okay, sure, all right. So I remember, as I once gave that example, within a week, I had lost about 3 patients. And so when I was entering into the next week, I became very, let me say, I was almost lost. I came to the clinic that morning, and I was there, I was there physically, but mentally, I was not there. And so when a patient comes and then the client is giving the history and everything, I'm listening. And when the person talks about something, I was moving based on instinct. So you just tell me, oh, the patient was in pain. I'm like, okay, sure, it happens. It's normal. I can no more show signs of, oh, sorry. All of a sudden, I've just become a robot. If the patient is suffering, sure, painkillers, we'll take care of it. If the patient is doing this, if the patient dies, I'm like, okay, it happens. We all lose patients. So I remember one time a client called me and said the patient died. The person was expecting me to actually express so much emotions. All I could just say was, oh, sorry, it happens.
You came with a point of view of a doctor. Let's look at it from the point of view of a pet parent.
Pet parent.
Because, like it or not, some of them are at the forefront of observing suffering all the time.
Yeah.
So, I was having a conversation with a friend about pets, and I was talking to them. I mentioned the fact that when the patient came, we took the patient to the theater straight away. We did a pre-surgical assessment, which of course everybody does. Well, not everybody, some people don't do, but we did. And we took the patient straight into the theater, did our protocols, and then took away the fetus during the CS. And the guys were looking at my face. So you did CS on a goat? I said yes.
Shocked.
They were shocked. Again, I mean, again,
In that part of the world.
in our part of the world, in our part of the world, when you tell people that you do CS on animals, they are shocked. Then he was surprised at the terms I was using. Patient, she. It made me ask myself one simple question. Is it a general thing that people do not care about animals? Because, like it or not, if we are really, I could see the exhaustion in the owner. I could see the exhaustion on the farmer because it was his first time. He was so much invested in that ewe. He was so much interested in that particular goat that at a point he couldn't even respond appropriately. He was so exhausted, and makes me wonder, why do people have to wait for that long before they respond to the suffering of their animals if they know that they are also going to suffer the consequences of seeing that suffering?
That's quite interesting. I think the most people don't this idea that the animals are they are strong, as in they
Withstand.
can withstand it. So you know, some people give sports food to the animals. The once the food is spoiled, it doesn't go waste. You throw it to the dog or you throw it to bingo.
Yeah.
Bingo's
Bingo.
gonna eat the spoiled bread. And so we assume that bingos that used to stain can kill bacteria and fungi. So you should take it.
Why don't we eat it ourselves?
So what is not good for you, what is not good for the gander is not equally good for the goose. So if it's not good for you, it's not good for the animal. But if we have this idea that the animals they are stronger, or they are more or less some kind of machines that can survive kind of things. And so when they are sick, we don't see it as an emergency. We actually think that they will recover all those things. But the issue is that unlike human beings that we are able to actually tell people that we are not feeling well, because mostly when the initial signs of disease manifest, it comes as symptoms. What you feel. So you tell someone that, oh, I have a fever, or I've lost my appetite, I feel pain. Nobody can determine that you have pain. You can determine that you have pain. So you, the human being, you can determine when your early signs of disease manifest, like malaria. When you start getting malaria, you can tell that I think I'm coming out with some kind of disease. Your pets cannot talk to you that I'm coming out with the disease. By the time that you start seeing the signs, that is a sign that the body has done all its best. You are now at a critical moment. So for most people, when they start seeing those signs, they think that that is the initial stages of the disease. But once they're seeing the signs, we have gone past be careful. It's no more be careful. We are now in danger zone. Because we have reversed it by how we see ourselves. But it's if we see the animals as example, let's say a dog goes to eat let's say some poisonous substance on the ground. Initial stages, the dog will start feeling pain. He might be moving around a bit, growling or showing some moaning and signs of pain. The owner might not understand these things as signs of pain, but the dog is already in its initial stages of disease manifestation. When the dog begins to vomit and then blood is coming out, that time is not the beginning of the disease. That time is the end stage manifestation. So that's when people think that, oh, it just started yesterday. So as they tell, I started yesterday. And so it's like, oh, there's still time. Oh, there's
Sometimes
still time.
the yesterday is like 2 weeks ago.
2 weeks ago, but there's still time. So by that time you start seeing the signs, that is a point of let me say emergency. So people have to now report or to bring their pets in. But because of the let me say the medical framework is not available for people. That's why we are here, to educate people. We don't have the medical framework to understand that when you see these things, you should report. So they come in late. and then we are forced to work miracles.
Aside working miracles, and let me go on to say that we are not psychologists. We are just sharing our experiences on some of these things with you. The following are some of the things that I think, based on my experience and what I've seen in others and what textbooks and research has for us, are some of the signs when you as a pet parent you see you should consider as you are entering into compassion fatigue,
Fatigue.
as you are being overwhelmed and exhausted anytime you see your pet, especially when they are suffering. Feeling detached and numb and emotionally detached from your pet. When you have reduced feeling of empathy and sensitivity. And let's talk about that. I've experienced situations where clients bring their pets to the hospital and they stand way off as if they don't care
Take
about the
the pet.
pets. Sometimes it makes me wonder,
Why keeping the
why are you
pet?
here? Why are you keeping the pet in the first place? I don't know if you see that, but I see it most
Yes.
often, and sometimes it takes me off my game. I sometimes I literally don't know how to respond to
Like they
that.
come and then they abandon, they dump the patient on you, and then sometimes even for them to even help you put maybe the dog on the table on the examination table, or even to um, comfort the dog, because the dog knows you. So once the owner you step back, the dog feels threatened.
Yes,
For
that
them to just stay close, they won't worry.
and so it's important we talk about this. I think this episode is more than what we are doing, because we need to have pet parents also share their side of the story, how they go through it. Because personally, sometimes I think about it from this perspective. How can you bring a pet to the hospital and then abandon the pet? Because animal behavior 101, the pet knows you more than it knows anybody. Outside its own natural environment, it feels threatened.
Threatened. Yeah.
So for you to leave him or her on somebody else's table, unless of course maybe we've had exposure to the pet for all its life, like some pets, a patient that I had, in fact, whenever the parents brought her, I met her, we played, and then she will follow me to the examination table, calmly lie down, and allow me to do anything that I want. And when I'm done, take her back to the car nicely. So from school till house office, I knew this particular patient. But I know nothing about the patient and you abandon them on me. I think that's one of the reasons why some pets decides to bite their doctors.
No, but so the pets have not been shown human love. You see, there are many reasons why people should have a pet, right? For either for example for companionship. You have companion animals. You have those for security, some for hunting. There are many purposes of keeping a pet for different reasons. Some also for I think this for therapeutic reasons. There's a word for it, habilitation,
Yeah, rehab.
rehab. So people who are going through emotional issues, health, mental health issues, and they recommend having pets around them to help them with these things. Now, if you go in for a pet as a companion animal, that animal is supposed to experience some kind of level of love from you. But some people have pets, they've never shown them any form of love. All they just do is give them food and walk away, lock them up, give them food. And so the dog has not been socialized enough to even be around human beings. So when you bring it to a clinic and you walk away and leave the petrol dogs in the with your doctors, you actually sentence your doctors to die. Because people think that we chop juju somewhere where we can just look at the dogs and they calm down. There's there's no training that will train you to go and face a wild animal. It's not, the animals are not, they have their own personality. And so we have certain tricks on our sleeves where we can do certain things. But no matter what, the dog knows the owner. So if you abandon them, so I think that the abandonment of clients, it's not, some of them naturally cannot tolerate seeing their animal in pain. Some of them even they have this they fear blood. What's the scientific name for that?
Hemophobia.
Homophobia. So whenever they
The
see,
hemophobic doctor.
we'll talk about that later. So when they see blood, they actually go back. So some of them, when they come, is genuine. They cannot stand these things. But there are others that they just come, and then I think the issue is that some of them, they are not the owners of the animals. They are either drivers or house helps who have been sent to bring the animals to the clinic. So when they come, it's like sending your house help to send your child to school. If your child cannot talk, you are finished. What will do to the child? He can't complain to you. So the dog cannot complain to the owner that when you let me alone with the house help, he slapped me. He cannot he can't tell. So I think that those people are the people that we mostly meet. The house helps and drivers who bring the dogs. They don't care for the dogs or the animal. They just dump them on us and then leave us with them.
And I think that's, for me, I think, well, I don't know about others, but for me, I think that's one of the main reasons for most of my burnout situations, considering the fact that somebody will bring a pet to the hospital and this particular pet looks abandoned on the table,
Yeah.
and you have to attend to it, to him or her. And when I sit down, I mean, I'm now beginning to realize, as we're having this conversation, that days that left me really burnt out, exhausted, that I wake up the next day and I don't even have the desire to go to work, were days that I really, really had cases of serious patient suffering. Yeah. I mean, they really left me burnt out. And that brings me to this point. I read this article that says exposure to even some of these exposure to some of these situations digitally,
Okay.
you even experience some form of it. And I'm beginning to realize why people will see somebody suffering and instead of going to help, will take out their phone and
And then
begin to record.
because that you have become apathetic to it. But the one thing people don't even know is that how it affects even both the health professionals like the veterinarians, the animals, and then the owners, is that the side effect of this compassion fatigue I'm talking about is that from the point of the healthcare provider, you carry this out of the workplace to your everyday life,
Yeah.
where
Yeah.
like nothing. So the typical example is that if you pick my phone right now and you go to my gallery, you see a lot of disgusting images. Yeah, I've been exposed to much of blood, abscesses, fecal matter, all those things. Clients will send you pictures of very gruesome things on their patient and ask you for advice on those things. So, like, we have come so much exposed to these things that every day. I remember one time I had just finished some very nasty surgery. I came out and I went and bought food. When I was eating, I was eating meat. People think all veterinarians are vegetarian. Not
vegetarians.
true. I really love meat. So, so I was eating meat. And then I was like, hey, dog. So after this surgery, you are eating meat. I'm like, what should I do? But you see, it becomes so normal. Like, you have become used to it. So, like, in your everyday life, even when you are related with other people, like, your emotions are kind of let me say bottled up. You cannot express much of it because you have seen so much of suffering, so much of, actually, in the area of euthanasia as a veterinarian.
The king of euthanasia.
where you have to euthanize
Patient.
patient, either for health reasons and other things. And sometimes maybe it might not be what you want, but it's a policy of where you work, and as a hospital policy, you must euthanize the patient.
And there's a nice term for it. They call it moral distress.
Moral stress. Yeah, there's a conflict between your moral principles and that of your professional obligations. It's like in the side of our colleagues on the human side, if you have to perform humane, they said they call it is it human killing? I think it's still euthanasia. So you are put between these two things. Either you do what is required of you as a professional. I remember I had a case, and I suspected I call it a brain damage. The animal had lost all sensitivity from the neck region downwards. It could not respond, or just lying down, nothing. So
Yeah, I think we had such a case when we were doing clinical rotations back in 400. The name of the patient was Thomas.
Thomas,
Yeah, I think I still have the X-rays and everything we did
because
on my
that
records.
case I recommended to the client that the animal can live, but it will be not be the quality of life will be reduced. It cannot move, cannot do. It's just be lying down. Even controlling of its bowels is a problem. It just keeps defecating, urinating, and a lot of bed
Forgive us
sores.
if you are eating.
A lot of bed sores and those things. So I told the client that the other option is euthanasia. In that place, it was the, let's say, compassion for the animal because of the pain it's going through. So the owner did not want to let the patient go. But I always tell people that sometimes we can be selfish. It's you, I think of yourself, like what will I do if the patient dies? But the issue is that the patients are going through pain, and it's much easier for us in the veterinary. If I don't put that way, in the vet world, that for our patients, they have that way out, and so we opt for euthanasia. But what people forget is that we the people who do the euthanasia. And in my time, I've done consultant amounts of. I have blood on my hands.
You have a lot of blood on your hands.
Utilized a lot of patients. And initially, I thought I could handle it. Yeah. When we were in school, I was given the title chief euthanaist. So I thought I could handle it. And so until one day, I euthanized one dog for a client. And when the dog died, like the breath,
the last breath
of the dog, I really felt guilty. Like I knew that was what I had to do, but when I was done, I went back to sit down, and the name of the dog kept ringing in my head, and I kept asking myself, "I've committed murder." But well,
so the consequences of compassion fatigue is really dire. Sometimes I remember one of those days after I lost a patient. It was a Saturday. After the patient, I had to attend to. Unfortunately, we were only 2 doctors on duty that day. And then we had other supporting staff helping us. And for whatever reason, I don't know, but on days that you're actually short-staffed, that is the day that it looks like they rang a bell that today the vets are open.
Bring all the cases.
So we had an overflow in the waiting room, and I remember on Monday when I was going over my patient records, because you have to go over stuff. I realized that I made a big error in treating one patient. Not like an error. I treated every other thing, but the patient was severely anemic. And in my treatment protocols, I failed to address it.
The anemia.
I addressed the inciting agent, but I failed to address the anemia. So then I picked my phone, called the owner, apologized in a very nice way, not to kill my own hubris, because I needed that hubris to
the ghost or the consulting room.
I needed that hubris to make a claim. So I called the patient,
The client.
I called the client, apologized, and with the hubris that I had, made a case that, see, the patient is this, that. Apparently, there was some level of improvement. So I told him to pass by for another set of prescriptions. Unfortunately, he was coming for review the next day. So he came back and then we did whatever that needed to be done. So you can imagine if this happens in animals and even animal doctors, veterinarians are suffering this much, how much more the one is to like 1,500 patient ratio with regards to our colleagues in the human sector. Well,
In
it is
Ghana.
the last time I checked, it was 1 to I think 4,000 or so.
That's very
But
terrible too.
that being said, I'm just using this to tell you that if you are not feeling well, don't wait for it to get to a point where it has and the sad thing is when you go and lie about it.
The usual. It started 2 days ago. It started 1 week ago. People don't want to be
To feel responsible.
yes, or to be to be called irresponsible. But I also think that let's also um let's also understand the client from our side and also the patient from the side of the our colleagues and human side. The issue is that the patient or the client does not have that medical framework that we have. And so we understand what it means to actually hide information from us, how it can affect our diagnosis and can affect even prescription. So if you don't tell us the whole truth, nothing but the truth, and you try to embellish the truth, we are likely to give you wrong prescription or even a wrong diagnosis. And then that will go against the
The whole
patient.
purpose of
But
you even coming to see
people
us in the
don't
first
know.
place.
They don't know they don't have. See, we have been in school for 6 years. So we know we understand the medical field, we understand the biology, the chemistry,
But Henry,
all those things.
let me not even
So
cut you.
we understand, but they don't. They've not gone to that training. So they might think that what they are doing, it's smart, it's okay. I remember I was giving an infusion to a patient, and then the guy, as usual, not the driver, and then he has somewhere to go. So he was telling me, can't I speed it up? I told that if I speed it up, your dog will join God very soon. So I went inside and he was with the patient. When I came back, the guy had increased the drip, the drop rate. When I came back, the thing was moving like pipe. I turned it back and I gave him a stern warning. I told that if the patient dies, I want to record it in the
Patient records.
record. A patient dies and any lawsuit comes, I'll meet him in the courtroom. I told you that, you see, but you see, I was angry at that point. But later I understood he does not know the medical framework. That if you think he thinks that we are giving that whole bag to the animal, why don't I just put it at once? I don't know what is called shock. That if you put too much at a time, you cause shock. To him, it makes sense to him. So from that point of view, we have to sometimes understand the patient or the client. They don't have our medical framework. They don't know what we know. But even we also know, we should do foolishness. Even a doctor would be giving drugs and you not complete the medication. I'm good sometimes where I don't complete my whole 7-day prescription. So even we those who have the medical framework, the knowledge, we sometimes do things that are contrary to the medical framework. So we have to give them some slack.
The cutting some slack we can do, but like I mentioned earlier on, we are looking at how to prevent these things. And I think for me, one of the ways, and let me stress this thing, you hear me say for me, because I've studied myself. But in saying what I do, maybe you can pick one or two. So don't take my word as the gospel. In as much as we are educating ourselves, we are also expressing ourselves. Yeah. So for me, one of the things I really did was whenever it happened like that, I detach from social media. Like I could go offline for days because I knew that I needed some space to process, and I actually had somebody to talk to. There are a lot of coping mechanisms. When you go to the internet, you can find many. But for me, that was my way out, talking to somebody and detaching from social media, because today on social media there is a lot more suffering. Like I mentioned, I said I read a study that said when you see somebody suffering, whether physically or virtually, you experience that kind of,
It's like you have been hit with a drug. So
yes,
the time comes where your body becomes used, you have built up tolerance.
yes,
So it doesn't move you. Yeah.
because I mean we are humans and there is no way we can live with without showing that level of care and compassion and empathy. And so to a certain degree you need that, but too much of that too is kind of like harmful to a certain. So for me, in order to sustain myself, these were the two coping mechanisms. There are others, but significantly talking to somebody else and detaching from social media, because I don't think at a point I muted everybody. I wasn't watching WhatsApp statuses. And when I go to Instagram, it's that I go and post and come back. I don't watch content because the more you are there, the more you are seeing. It looks like it's automatic. When you see pain, you kind of like get exposed to some more pain on Insta. You get to see things related to pain all of a sudden.
The algorithm begins to push it.
Yeah, it's interesting how it even happens. And so these were my coping mechanisms. But I mean, to wrap up, what were some of the things you used in coping with compassion fatigue, and some that our pet parents can make use of?
I think for me, the first time it hit me, I went off for almost 2 weeks.
Wow.
That was when I think my first few months of housemanship, or let me say national service. um, it was I think we had a surgery or so, and then patient died mid surgery. The patient was actually I call it a high risk patient. He still had to try to salvage the situation, but the patient died. And since I was the assistant surgeon during that surgery, definitely now you have more responsibility on your hands. So, and when the patient died, I just all of a sudden I froze on the table, on the surgical table. I was just there with holding my the scalpel, and it's like I've seen it in movies and things where people like freeze. Even when I watch medical movies and people are like, I thought that it was like drama until I just froze, and then all of a sudden I was hearing my colleagues speak, but it's like I was not around. When I came to myself, I went back. After you started like it, I kept blaming myself. I had killed the patient. I had killed the patient. See, and for 2 straight days, when I came to a clinic and I see surgical instruments, I get panic attack. I get some kind of
PTSD.
PTSD. I vowed I will not touch surgical tools again. And it was coming so well that whenever a patient comes, I don't have confidence in me go towards the patient. I felt like I think this thing imposter syndrome.
Imposter syndrome.
It was very bad. So I had to. I spoke to a senior colleague, I think Dr. Livingston, and then he now told me that, boy, these things happen. You have to pick yourself up. So for me, I spoke to colleagues that were ahead of me, and they counseled me and told me that that does not make you a bad vet or anything. These things happen we are not gods, and that's when I came to understand that I cannot save every patient, and that was how I said to cope. But at the end of the day, I ended up coping too much that I built this kind of immunity. And so sometimes when I see a case where it's very bad, I begin to invest less of emotions into that case. So if I see a case where there's maybe acute poisoning and the case has gone down for more than 6 hours, definitely chance of survival has been reduced significantly. So I
So automatically your prognosis
prognosis
is
is bad. So I usually when the client will tell me that, oh, what is my prognosis? Those days I will tell the person that, oh, the animal will make it. I've said it before and the animal died. So I made my mind that when I see these cases, for my own mental health, I will tell you that the patient might not survive. I will tell you 30%. I'll give you the lowest prognosis I can get medically speaking, so that I don't invest so much of my emotions and my medical integrity into it that when the patient does not make it, then the client will think that one, you lied, or you're not good at doing your job. And also, if you invest, as in you are with the some clients like to talk a lot. So you are talking with the client and you are experiencing, you get to know the client and the patient more, and the patient dies. It hurts more
yeah.
when you know the patient more. But you see, as health professionals, we are trained to know our patients. We are trained to connect with our clients because we treat both the client and
In
the
the patient,
patient.
yeah.
So you are trained to get close with both the client and the patient. But the case where the more you get to know your client and your patient, the more you feel pain when they are going through pain. I told you of a case where around 4 a.m. I got a phone call. The patient had died. The client was crying, and I woke up from bed 4 a.m. I had to console the client. I was confused, like phone call. You know me, and I usually sleep late, so
Yeah.
I woke the phone woke me up. I pick up. The lady was crying. The patient is dead, and it messed up my day. But I had to like console. So it's, to me, I had to build that kind of wall, so at least I could help prioritize my own mental health. Because if not, if I invest too much, I'm gonna get to the point where I'll break down. And you know, the statistics are saying that veterinarians are more prone to suicide around the world. The statistics show that veterinarians have more suicides than are more prone to suicide than other health professionals. So I don't end up being part of
The
the
statistics.
statistics. So I have to protect my mental health. So if you see that sometimes we behave, you go to the clinic and your veterinarian looks a bit detached, looks a bit cold. It's not they are doing. They have experienced so much suffering that they are built up this kind of wall to protect their own well-being.
Yeah, but should
Yeah.
I justify bad behavior of some?
No, that one is a different case.
Anyway, so as we wrap up this episode, we just wanted to talk about the cost of caring, aka compassion fatigue, and we've shared a lot of stories. I remember one of these days in the clinic, a colleague gave a patient to me. I mean, what I mean by that is that was his patient. He wasn't on duty. I stepped in for him. The following day, he decided to let me continue with the patient's care. Apparently, he has been treating the patient for right-sided congestive heart failure,
Yeah.
comorbidities of right-sided congestive heart failure, and then liver disease. Both of them at a go.
Very bad combination.
So recurrent ascites. We had to drain. The patient was recovering, and then I think at a point that taking and the owner, like you said, talks. She likes to hear your side of the story. So the patient didn't make it in the end, but he lived its best life, his best life, and may he so rest in peace.
So
So
is it Thomas?
no, that's not
That's
Thomas.
not
It's another
Thomas.
patient.
Okay.
So my colleague left the patient to me. I didn't understand why until I decided to dig deep dive into this whole compassion fatigue thing, and I realized that Charlie Chama was really going through a lot with the patient. And so, thank you for joining us for this episode. Again, my name is Dr. Emmanuel Boachinim, and I had this episode with my brother.
Dr. Henry Asigri Abugri.
So the next time you go to the vet or you go to the hospital, know that not just the bills that you are going to pay, but there's a cost, emotional cost of caring for you. And if you have pets, you take them to the hospital, there's an emotional cost on you and their doctors. And so have that in mind and act responsibly and accordingly. Thank you for joining us and see you in the next episode.